A growing health alert across the country tonight that NewsNation has been tracking for the past 10 months. Gas station heroin. A new FDA warning is telling people not to purchase or use Neptune's fixed products. The product contains the ingredient tianeptine, prescribed as an antidepressant. It can mimic an opioid. It's also being sold as a dietary supplement. It's among a growing class of substances that are difficult to control, easy to buy. You can get it at convenience stores, smoke shops, and online. We've spoken with several users of the drug. They didn't want to go on camera, but they did have this to say. You have to dose every 4 hours to prevent withdrawal. Once you're hooked, that's 5 or 6 bottles a day. It's easily a $150 a day habit. Also this, quote, I couldn't believe how much it resembled opiates. Another person saying, quote, I used to have a 6 to 9 bottle a day habit. Here now to talk more about the dangers of this is Kaitlyn Brown, the clinical managing director for America's Poison Centers. Kaitlyn, thanks so much for coming on tonight.
Oh, you're welcome. It's my pleasure.
Can you explain to our viewers exactly what tianeptine is? What makes it so addictive?
Right. So tianeptine is marketed as an antidepressant in other countries outside of the United States. And what makes it so addictive and unique is that it acts on opioid receptors, very similar to oxycodone or hydrocodone. And that is what causes those addictive properties.
Why on earth would this be available over the counter at gas stations in this country?
You know, it's an unregulated product, so it's sneaking onto the shelf. It's not something that is going through any sort of regulatory agencies, and it's just uncontrolled. So it's not really clear as to why it's on the shelves other than, right, it's selling to consumers.
Do we know how it is being made or manufactured? Is it within this country? Is it crossing borders? Is there any involvement with cartels or our southern border?
At this time, I am not aware of any of that information.
I appreciate that. We talk a lot about the fentanyl crisis here at NewsNation. Many people are now labeling it an epidemic in our country. What are your concerns with this particular product? Is it that it's sort of under the radar? Maybe a parent who sees this bottle in their kid's backpack or in their room wouldn't even know what it is.
Right. I think one of the most concerning things about this product is the accessibility right now. It's in communities, right, like you mentioned, at gas stations, convenience stores. So anybody can really purchase it. And that can lead to a lot of challenges and harmful effects, especially if it goes into the hands of youth or adults alike. It can cause those life-threatening opioid symptoms, and then it can also result in addiction and withdrawal syndromes.
Have there been any deaths linked to this substance so far?
As far as what has been reported to U.S. Poison Centers, we may have had 1 death reported in 2023, and that is under review with our Fatality Review Committee.
In recent years, we know emergency rooms have seen surges in users who are struggling with withdrawals from this specific drug. If someone has been taking this habitually for a period of time, what do they need to do?
Yeah, so one of the things that I would recommend they do is to reach out to addiction services nearby so they can help come off of this substance, just like you would come off of opioid or another similar product. It's really uncomfortable to go through and can be very challenging to do. So, medical assistance in this process is going to be critical.
Okay. Kaitlyn Brown, I appreciate your time tonight. Thank you.
Yeah, thank you.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.